Welcome back to part 2 of Is Leaking Normal at the End of Pregnancy? Well, we already established that it's common, but it's certainly not something that you should have to deal with. So I'm going to share with you 4 actionable strategies that you can do to resolve or optimize leaking at the end of pregnancy. I'm Susan Winograd with Pelvicore Rehab and Wellness. If this video is helpful, please make sure you hit the subscribe button so you don't miss any other amazing videos. So you deserve to stay dry and confident and comfortable at the end of pregnancy. So if you are experiencing some leaking, the first thing I want you to do is start with the breath. Don't ignore the power of the breath. I always tell people breath is like yoga for the pelvic floor. And you want to think of the inhalation as the lengthening, broadening, and the relaxation part of the breath. And you want to think of the exhalation as the engagement, the contractile, the shortening part of the breath cycle. So if you are in your last trimester of pregnancy and you feel like there's so much pressure on your bladder and you want to control that leaking, work with the exhalation. When you're going to lift something heavy, do it on the exhalation, because that will mean you're working with the natural part of the breath cycle. That's when the pelvic floor is supportive, when it contracts. Now, if you're lifting something heavy, and this is tip number 2, you want to get a little more support from your deep core system. So you're going to do the same thing we just talked about. You're going to use the breath, but you're going to add a little bit of resistance to the breath. So instead of just exhaling, you're going to go shh or s. You're going to give that breath a little bit of resistance. Go ahead and try it, and you'll be able to feel that you're getting a little bit more recruitment and a little bit more support. It's so helpful and effective. The third tip is get the knack of doing the knack. The knack is a Kegel. Before you laugh, before you jump, before you cough, before you sneeze, before you do anything that requires exertion. And the reason why this is helpful is because, number 1, it retrains that anticipatory response of your pelvic floor. The more you do it, the more it will happen naturally, and the more you'll be able to restore that natural anticipatory response. It's like giving your pelvic floor that extra added input where you're saying to it, hey, this is what I want you to do on your own. I don't want to have to do it for you every single time. But you got to do it in order for that to happen. Your body will not integrate something as automatic unless you repeat it over and over again over the period of time. Bottom line, get the knack of doing the knack. The fourth thing is I want you to stay connected to your deep core system during pregnancy. Your body is changing so rapidly during pregnancy, and your alignment changes. The more you can stay optimized in your alignment, and I want you to think ribcage over pelvis, the better you will be able to recruit your pelvic floor and your deep core system. And then my final tip is don't ignore it. These are really general tips to help you improve leaking at the end of pregnancy, but absolutely see a pelvic floor physical therapist who can individualize these strategies for you. Now remember, what's common is not normal. You deserve to feel great throughout your entire pregnancy. I'm Susan Winograd. If you found this helpful, reach out to Pelvicore Rehab and Wellness.